Hello, everybody. This is Danny Ramos from Hispanic Speak Out TV, brought to you on Spectrum Cable and also on YouTube. We are doing Skype interviews as a result of the clampdown on people traveling. So we're continuing our interviews with high-profile people in our community so that we're better informed of what's going on with the coronavirus and how we should react to this situation. Today, I'm on the Skype with Senator Victor Torres. He is our state senator here in Central Florida. And as you know, he's extremely active in the community, been extremely active in the community all his life. Senator Torres, you just sent out a release to the governor. And tell us about what is the content of that communication to the governor from your office.
Okay, thank you for having me on, Danny. This is a pleasure. I'm glad you're reaching out to the community as well. I sent out yesterday a press release concerning the coronavirus and how it's affecting our community, and we need to stay at home request. Many of us senators have sent out this message to the governor. Our concerns is that this virus is growing day by day. It's spreading among our community. We need to grasp and take a hold of non-essential services, people not being out there hanging out or going to the beach or going anywhere that they don't need to go unless it's a necessity to them. But otherwise, this request, I haven't heard any response from the governor's office yet, but I want the people to know that I feel my constituents and the constituents of Florida need to understand the importance. This virus is getting worse. It's not getting better. It's gonna affect all of us, not just seniors and not just sick personnel or children. It's gonna be everyone is gonna be affected by this virus. And I'm afraid that if we don't take this serious action, it can cost many more lives that we don't need to. But I want to go into what's happening in the state. What is affecting the coronavirus is affecting economics, jobs, businesses, healthcare, schools, you name it. The theme parks, everything is closing down. Everything is closed down. Why? Because they know how serious this is. And the right for people to stay home and be protected is what I'm asking people to understand how important it is to obey the law. I come from a background with law enforcement, and I know when I got a call, I had to come in because of an emergency. I knew my first job was keeping the people safe, and this is what I'm looking at. My priorities is keeping people safe, keeping the children safe. Making sure that people are well protected, or people are getting what they need in their homes. Right now, the unemployment is skyrocketing here in Florida. It's going day by day. It's more people applying for unemployment benefits, and they need to know what's going on. We also have a large immigration population. Are they going to be covered for health care benefits? Are they going to be protected? And their kids are going to be protected. We have homeless families. So the list goes on. The elderly, the college, the universities, they closed down. Our schools closed down. They just canceled the prom graduation and bash for Orange County so far. And they're hopeful that they can do their graduation ceremonies. So in essence, that's what's going on today.
You just mentioned immigration families. Okay, so here's a little twist: legal and undocumented and documented. Now, obviously, if they're documented, I have not heard anything about, monies going to immigration families that are documented, that are here legally. What about them? Because I've been watching the news from Washington, and nobody mentioned anything about that. And what about the large number of people that we have, particularly in our community, Victor, that are Hispanic, that are undocumented?
Right. Well, that's one of my concerns, because remember, they live among us. Their kids go to our schools. They work among us. Even if we say, well, we need to know who's working in our department stores or housekeeping or our lawn services, whatever, construction, you're talking about a huge economic impact on the community. These folks are here, and we need to know that if we want to stop this virus and have them stay at home, if one of them gets sick, we need to make sure that they're provided health care. We don't need somebody with a virus walking around us and you're saying to them, well, since you're undocumented, tú no tienes derecho, you don't have any right. But guess what? They have every right. They've been here. They're here. Let's take care of them. Let's cut this off and let's make sure that those people, because we have a problem in the state of Florida, Danny. You know, we have over 1 million people who are uninsured. 1 million. Why? Because in the House and in the Senate, they refuse to expand Medicaid expansion. So that's a big argument that I have, because you don't even want to cover your own people here in the state of Florida. Meanwhile, you're going to tell me about undocumented. Well, guess what? The two work hand in hand because they are part of society. They are part of the people that are here every day among us.
But you know, and I know people that are undocumented, they're, particularly in these days, they're very fearful of getting any kind of exposure to government at any level of government, you know, and to get those people to come out, and even if they're sick, to ask for services, they have a tremendous amount of fear of coming out and saying, you know, I'm on, you know, because they're afraid they're going to be picked up. You know that.
I think at this time, with all the things that are happening in this country, they might have that fear, yes, but they have organizations working around them that are telling them, encouraging them, don't hide. If you're sick, come out, let us know how we can help you. There's no guarantee. There's no guarantee, but I'm telling you right now, this is a serious situation we're in. If you try to tell me that those folks, if they're infected and they're still among us, and then we don't find out how serious the case is, because people don't know, people are guessing. And as you know, every day, the state is changing its policy. Every day, we're getting new orders. Every day, our county, look what happened here in Orange County. Orange County yesterday. Shelter at home, stay at home, don't come out. If you don't need to go out, please do not go out. Let me say something. I just went to Publix to get medication, my prescription. I called up first to make sure the prescription was filled out, because sometimes they're running out. When I went there was other seniors there getting their prescriptions. I encourage every senior who has a prescription, call your pharmacy before going out. Make sure that they have it and have it ready for you and notify you when you to come and pick it up. These are things that are easy to follow. This is not nothing hard to follow. Well, you know, and these are things that are changing every day in our, you know, the restaurants are closing, the hotel bars are closing, the nightclubs are closing. They closed some of the beaches down already. You know, these are issues that are happening every day. And as you look out through the state of Florida, we are having shutdowns, shelter in, stay at home, don't come out, curfew hours. This is happening right now. Why? Because we look at New York, we look at California, we look at Chicago, we look at other states that are going, Washington, all these other states. What happened? They didn't move fast enough. We in Florida, last night on a TV program, they were talking how vital that we are growing with the virus in Florida, and people are not taking this seriously, and this is the issue that we have.
You know, people are always comparing this to the flu, and every year they say that 20,000 people die of the flu, 20,000 people have not died of the virus. Yeah. So I think a lot of people are saying, it's not as bad as the flu. You know what I mean? It's not as bad. I think the big deterrent here is that we don't have any kind of medical stop, any silver bullet, gold bullet to stop it with the flu, because I got my flu shot. I went and got a flu shot. So I go every year and I get my flu shot. But this is something that doesn't have anything to stop it or slow it down right now.
No,
So that's why, the numbers don't match the flu, but I certainly think they can, if we don't do what you're saying.
this is what the experts, the health experts are saying. The less you're exposed out there, the less of contact that you will have this virus. And remember one thing, Danny, that when you had the flu, I had a shot at the VA as a veteran for flu, and guess what? I got sick. I had the day I took my shot, I got sick. But
that happened to me too.
So that's my point. The flu shot is like 1 in 10. You don't get it. It prevents it. You prevent it. They have. They always say every year it's a different flu strain that's out there. But and I know, you go out there and you get your flu shot. You say, hey, I need to have this shot just in case. I don't want to get sick. I don't want to miss. I don't want to contaminate anybody. And that's the procedure. But this coronavirus, this pandemic has escalated in such a way. It's global. It's global. It's not just the United States.
You know what amazes me? What amazes me is that we have an atomic bomb for every single person on the earth. We can literally wipe out the entire human race in 15 minutes. And every atomic bomb costs $50 million, or $100 million. And we have not planned, even though these epidemics have happened in the past. The government is not ready and has not been ready. You remember Katrina, right? They weren't ready to handle Katrina. They didn't learn from that. The government is not ready to handle major national emergencies, although they can be, but they're not ready.
You hit a good point that what President Obama had instituted as a result of the Ebola, and it was the N1H1, another ailment that they had, but he developed a specific department to deal with this. And this president taking office, one of the first things he did was get rid of that office. Now he's caught with his pants down, and he doesn't know which way to turn. And he's got an excellent doctor who's a specialist in these type of situations, trying to tell him, look out, we need to have more measures. We need to understand what the circumstances are. Danny, we can't even get a vaccine. We don't have ventilators. We don't have N95s.
That's another thing. That's another point, Victor, that we don't have ventilators. During World War II, when we got attacked, in 3 months, we converted every automobile manufacturer in the country to making airplanes. It took 3 months. Everybody was making airplanes and tanks, and that means a retooling of an entire country. And we can't get this thing rolling. You know what I mean?
This is the point. They're trying to get him to institute an executive order, presidential executive order, to make that happen, so he can have these companies retool and get the ventilators. Look, New York City needs 25,000 ventilators. They're only getting like maybe 4,000 or something like that for 25,000 people. They're trying to control or share. This is the ironic part. Share a ventilator with like 2 patients. This is something that this country has never faced. That's what I'm saying. I don't want Florida to be in that type of crisis.
Well, if government has money and government has the capability, why don't the government go out and make it? Get experts who are involved in these fields. Get your 5 experts or your 10 engineers and send them out to go to rent a facility and go out and make these things. Like they did in World War II. I mean, World War II, they didn't hesitate. They said, okay, we're going to take over these buildings. We're going to manufacture these things, gather the resources and people we need, and put them to work. And in 2 or 3 weeks, we can have ventilators being made.
Let me point out something else. And it came up the other day when they said they were going to have the field hospitals. The Army the Army Corps engineers, field hospitals to develop. Why they didn't do that in Maria, in Puerto Rico? Those field hospitals, right? Now they're trying to get them to put field hospitals to help. My point is, you do it when you want to do it, or you have to do it. And that's the issue right now. We need to have more nurses, more doctors. We have to look out for those in nursing homes, because remember, in the nursing home, they're confined. They can't get out of there. And they're depending on those people, those providers to take care of them. The family members can't go in there. So these are issues that we're looking at every day. How do we protect those folks and make sure that they have what their needs are? You know, it's Danny, it's a huge project. It's not a simple project. The huge project entails that the federal government needs to work with all our governors and bring them in and say, this is what our state legislators, this is what we want to do. This is what's going to be. They're going to pass, or they did pass today, I think, a $2 trillion stimulus package, and it's going to go out. But there needs more work to be done. This is not over yet. This is not. Yeah. This thing is not gone away.
The stimulus package is going to help me. You know, I'm going to get a check in the mail. It's going to help me because my business is zero right now. And, you know, you can see how we've adjusted. Instead of people coming to the studio for interviews, we're doing the interviews over the internet. We're still broadcasting, but our money has completely dried up, you know? So we are suffering like everybody else is suffering. One of the things that I wanted to talk to you about, and I remember in the old days, and, you know, I'm an old timer, you know, I hate to admit it, but I'm going back to the Bronx in New York. Yeah. When the banks in New York were taking money from the Hispanic community and lending that money out on Long Island for economic development projects, so they would go into the Bronx and take everybody's paycheck in the Bronx, and all these retailers was packing money into, at that time, Citibank, and then Citibank was taking that money and reinvesting it out of the community. So my question, you know, I go up and down, like in Kissimmee, you see all the banks, you see Regions Bank, you see 53 Bank, you see Bank America, all the banks are there in our community. So I'm just curious. I'm very curious because I remember that happening back in the Bronx in the 70s. Why the banks are not taking an initiative or making a statement to say, you know, we're taking your money, all the money in those banks in Hispanic neighborhoods, that's Hispanic money being deposited. Why aren't they offering that publicly to small businesses who are qualified, or maybe, you know, some kind of a rule that they can make up? But the banks are very quiet right now.
Well, they just came out with a small business loan. I just got a message that they were doing something to help small business loan. They can go online with the Department of DPPR, and they can get small business loans. I can't speak for the banks. I don't know what the banks are doing, or are they cooperating with DPPR to get small business loans. I would encourage anybody that's hearing this, go online at Small Business Loan and see. They revamped it. They put some money in there, from what I understand, and they're going to help small business. So that means todo hispano and other community business leader to understand they need to go online and check to see what they can get and make sure that they follow the instructions. So that, because listen, when you don't use a service, you know what the state does is, well, nobody applied for it, nobody cares, nobody needed money, nobody, you know, this is something they look at. People need to respond and go online. It's just like the unemployment. People are calling unemployment left and right. They can't get through. The website crashes. The phone numbers, they busy signals, or they don't have an answer. Nobody answers them. These are issues that are going on every day as we speak. And this is the question: housing. People are looking to pay their rents, to, you know, stay in their hotels, whatever it is that they live in hotels. These are questions that are coming up every day. And this is why the governor of the state of Florida, his agencies need to address this. They have to put it out there. They need to tell the people, call this number. We have people waiting for your calls. Go online, do an application online. But when you're online, it doesn't work, and your phone system sucks. You know, guess what, Danny? People are holding the bag, and they're going like, contra. They ain't helping me out, man. You know, and that's the bottom line.
Yeah, there's a tremendous lack of communication from the government directly to the grassroots.
Yep.
It's just not there, you know. I've spoken. I have a small business owner that I'm talking to at 4 o'clock today, and they're going through the same problem. They try to call people, they can't get through the government. You know, like you said, the lines are constantly busy. Nobody, they can't get a response. I know this lady who has a business up in Kissimmee. She worked for 5 years to save money to open that business, and it opened just before the virus hit.
Oh.
She hasn't had anybody for 3 weeks. She had to close down. I have a lawyer who's a Hispanic, a Puerto Rican lawyer, a woman. She said that she hasn't gotten, and she's an attorney, she hasn't gotten a phone call in almost 3 weeks for her business. And she's a sole attorney providing services to our community. So this is terrible situation. We're getting, as a Hispanic community, we're getting really knocked out. A lot of people will never recover from this. It'll take them 10 years to recover from this.
Absolutely, absolutely. This is monumental. This is something that a lot of folks never realized that this was going to affect them in such a manner. You have folks that want to go back to work. You have companies putting out, well, we're looking for workers. Walmart looking for workers. Publix looking for workers. You know, because they're always supplying food, you know, and other essential items to folks out there. So people keep on shopping. But the bottom line is, this is not the answer to you who have to pay a rent, you who have to drive your car, you have to pay for gasoline for that car, the insurance for that car. What is happening with the overall working class folks out there and how they're going to be protected? What is the federal government, the stimulus package? I'm just afraid that the demand is going to be so great. There's going to be obstacles for people to get those benefits, for people to pay off their mortgages or continue paying their mortgages, or paying, you know, their car bill, you know, that they owe for on a car, you know, how they every day they survive, and whatever they get right now, would that carry them for the next 2 weeks? Because you know what? It's going to be more than 2 weeks. It's going to be 2 weeks.
Yeah, it looks like it's going to be 2 months at least, you know? Yeah, because we're having, the situation is, like you said, in New York State, if they don't have a way to cap it, and it's just going to keep growing and growing and growing. Somebody said, I don't remember what the source is, but they said that this can result in New York State of up to 40% of the population having the virus, which is 4 million people, maybe 5 million in Metro New York. You know, New York is not just New York City. People come across the bridges and the tunnels to get into that city. Then they go back out to Jersey and Connecticut. So they're carrying it all over the place, you know? So it's an extremely dangerous situation. And I don't even know if this, I have no insight as to whether or not this financial package is going to be able to carry us for the length of what has to be done. I had a lady call me. She called her bank on her car payment. They said, no, you still have to make the car payment. Yeah. She lost her job 3 weeks ago.
Yeah, and that's my point. That's my point.
Yeah, exactly.
You know, the governor puts on another order out on anybody traveling from New York and Connecticut and New Jersey coming here to Florida. They have to self-quarantine, right? That's what he put. That's the order.
Yeah,
right.
Yeah,
I saw that. Right? Okay. What about the guy who's driving with his family in a car because he can't afford the airfare? So he's driving from New York over here.
Yeah.
How many are coming in their cars from all those 3 states who are driving here? Huh?
Well, I can tell you, if you know, people are abandoning New York. They're going, okay, if I can't go out, I'm going to jump in the car. I have my family in Orlando. I'm going to go to Orlando and stay with my family in Orlando or Tampa or Jacksonville or Miami. Those are Hispanic pockets. So I am sure people in New York are saying it's time to visit my aunt in Florida. Everybody load up in the car.
Let's go to Theo Victor's house. He's down there in Orlando. You know, I mean, the reality, you know, the sad fact is that I have my brother. He's up there. He's the same age I am, in the 70s. and he has ailments, and I tell him, don't go out, don't go outside for anything that you don't need to, and his wife as well. And I know that it's not something easy staying in a house 24/7, because you get either bored or you go stir crazy. I mean, even here, I mean, Orange County, Mayor Deming said, you know, you can go for a small walk, you know, and walk your dog or leisure walk, but don't congregate, don't mix with anybody, just come back home. They're trying to be reasonable, Danny. That's my point. But some people don't understand what reasonable means. It doesn't mean you go out there and you say, well, we're going to have a big party this weekend because you don't know who can come to your house with an infection, and then you all have it.
Yeah.
And that's the point.
You know, one of the things that I noticed here in Orange County was that the gun stores have sold out everything. There are no guns in gun stores, and there's no ammunition. Ammunition is gone. I went to Apopka to shoot straight in Apopka. I went to another place here in Orange County on Oak Ridge, right here off of OBT. You can't even get a box that a gun came in, let alone a gun. They're totally sold out because people are afraid. They're afraid of there's a collapse, economic collapse, you know. And I guess that the government has to get this stimulus out right away, because there are people who will resort to extremes when they don't have food. You know, this is a bad situation that can escalate.
Yeah, and that's what we are afraid of happening, because when the supply and demand is on the brink, and like you said, I read the article on that, on people buying firearms. I saw in the newspaper, and I went like, you know, the mentality is, if I have my gun, I can get anything I want when I want it, or it doesn't matter who I take it from. And we're not a society of that. We're a society of helping each other and looking out for our neighbors and our friends. That's what we are.
But you know, every society has a bad element to it that takes advantage of situations. You know, they'll break a store window, and in 3 seconds, they'll pick something up of large value and run. You know, there are people in every society that do that. And so that's the part of Jerry Demings and his law enforcement background, to make sure that Orange County doesn't turn into a situation like that. But I'm sure they're prepared.
Oh, I'm sure that Sheriff Mina, with the two mayors, Demings and Buddy Dyer, and the chief of police, Orlando Rolón, are very, very capable of looking at every scenario that they're going to face, especially now with the curfew, and making sure that they have more officers on the road, because remember, our schools are closed, so they have those extra officers to work those hours and patrol. And I hope they're working in dual patrol, meaning 2 officers in 1 car for their safety as well. You know, so these are things that I look at, that it's good for the public out there, you know, safety.
Yeah. Okay. Well, listen, Victor Torres, Senator from Orange County, thank you very much for the time that you've given us. And what I'd like to do is stay in touch with your office, have your office stay in touch with us. Any releases that you have, we'll read them on the air to make sure, and send them out to our email list. We have almost 100,000 Hispanics on our email list. So just look at us as an outlet for you to be able to get your message out to the community on an ongoing basis.
No problem. And as I get messages, I'll make sure that my staff sends you the information, so you can let your viewers see it and get a notice about it, because some of them don't know what's going on.
Yeah, and anytime that you feel you want to get a message out visually, just call us at the office and we'll set this up like we did just now. Okay? We're totally at your disposal. All right?
Thank you, sir. Thank you for the opportunity. And God bless everybody. Thank you.
Okay. Thank you, Victor. Be safe.
Thank you.